Good morning, supervisors. Good morning, community. Um, I'd like to offer the COVID-19 update for today. Alvaro, if I could have my slides, please. I'll review some of the numbers in terms of where we are, and then outline some of our key strategies. Next slide, please. I'd like to start with just a detail of the painting that you may have seen behind me many Tuesday mornings. This is a painting I purchased in Delhi, India, when I was working for the CDC doing tuberculosis research, and it's a painting by a young Kashmiri artist who was a tuberculosis patient in a TB ward in the kinds of hospitals that we're seeing in the global coverage of what's happening with COVID-19 in India now. And he was inspired to create sort of an image of what he thought would be the best healing environment. So placed a tuberculosis ward in a forest with trees and peacocks and grass, and it resonated. And just wanted to offer this as a counter image to so much of what we're seeing coming out of India now, and an acknowledgement for those that have family and friends in India with what they're experiencing now, with more than 300,000 new cases per day, every day for the past week. And record numbers of deaths as they accumulate, and to sort of to acknowledge the privilege that we have of ample access to vaccines. In fact, a surplus of vaccinations now, and the global nature of this pandemic. Next slide, please. So these are our numbers, our epi curve. This is since the start of the pandemic, almost 12,000 cases. 115 active cases in our community. We've had a total of 384 individuals hospitalized, almost 500,000 tested, 181 deaths, and have vaccinated nearly 174,000 residents. Next slide, please. This is the California Blueprint for a Safer Economy, and shows on the left the current status of all counties. The governor will make an announcement at noon today. We are confident that we will not be moving into the yellow tier. Our adjusted case rates last week, our unadjusted case rates were 2.5 cases per 100,000 residents, which adjusted to a case rate of 1.5. That being less than 2, we had 1 week accumulated in the yellow tier. This week, our unadjusted case rate is 2.8. So only 0.3 above what it was last week, but that adjusts to a case rate of 2.5. So that being above 2 puts us back into the orange tier. Next, please. And I'll talk more about why that adjustment factor changed. So these are we've been speaking now every week for the past 5 weeks, and I have offered a different assessment of our tier status. Going back the past 5 weeks, the sequence has been orange, then yellow, then orange, then yellow, and now we're back in orange. So we really are, as I indicated, even starting 2 and 3 weeks ago, stalled at that margin between yellow and orange. And on this graphic, you can see that the bracket that corresponds to that interval of time. And the differences are so subtle that it's really hard to appreciate, looking at that line, any significant trend. But because we are really at the margin, week to week, we flip from one side of that line to the other. Next slide, please. See, these are the contributors. There are 2 main factors with regards to us moving or staying in the orange tier. One is case rates and the other is testing rates. And I'll break those down. With case rates, since mid-April, we've had a slight rise in cases among our younger white residents. As you know, we break down our case rates by geography, by race, ethnicity, and other groups that allow us to target our strategies. What we see here on the left, on the top, is the orange is white residents. And you can see there that they make up the greatest number of cases overall, which is a reversal of the historical trend in Marin County. And it is an increase starting in mid-April. And then on the bottom, it's age. And it shows that age group that it is most significantly increasing is those age 19 to 49. Next, please. I'm sorry, Alvaro, can you go back to that slide? Um, so those cases are associated with travel, including we reach out to every case and do an interview to determine where they may have been exposed. And what we're finding is not one particular pattern or one particular outbreak, but rather sort of a series or a constellation of behaviors that are summing to an increase in cases. We're hearing more about travel, including day trips, people taking trips with other families to other parts of the state. Small social gatherings between groups indoors, where there's an assumption that it's safe, including with people who may have had one dose of the vaccine but not fully immunized. And then hosting visitors. At least 3 of the cases where someone had visited from out of the area was staying at the home and then developed symptoms, and then the host, one of our residents, became positive as a case. And the transmission that we're seeing is primarily indoors. Next slide, please. The other contributor to our staying in the orange tier is the decline in PCR testing rates. And this is a bit of a paradox as we move forward, because as we get more and more individuals vaccinated, there are fewer and fewer people seeking testing. The CDC says that for people who are vaccinated, who have been exposed, they don't need to be tested unless they develop symptoms. For people who work as essential workers who had in the past undergone regular testing, regardless of symptoms, after being vaccinated, do not need to seek testing. We're also at the same time doing a lot more of the BINACs, the rapid antigen testing, which is not a PCR test. Those tests are not counted in the state's numbers. So we have an appreciable decrease in testing rates for those 2 reasons. And that impacts the state calculation of our rates for the tier assignment. So while we had an unadjusted rate of 2.8, we only had a little bit of a correction down based on testing rates to 2.5. And that's because there's less PCR testing happening. Next slide, please. So now getting into our vaccinations, we are at 83% of our population who are eligible to be vaccinated. Those age 16 and above have been vaccinated with at least 1 dose, and 62% have had both doses of the series. Next slide, please. And by age group, as we know, we started with our age 65 plus, so it makes sense that that's the group that is most highly vaccinated. A full 86% of our residents above age 65 have received both doses of the vaccine, and only 4% have not been vaccinated. 17% of our residents age 50 to 64 remain unvaccinated, and 25% of our residents age 16 to 49 remain unvaccinated. Next slide, please. And this breaks down our vaccination rates by race, ethnicity. And we've seen that our Latinx residents have now slightly higher vaccination rates than our white residents, as we seek to keep up with the disproportional impact and burden of the historical burden of COVID-19 in our Latinx community. These high rates among our Latinx residents probably also are contributing to the relative progress in that group relative to our white residents. Next slide, please. This is a state. The state is now offering vaccination rates by every county, 58 counties across the state. This is a busy slide. It's easy to pick out Marin County because we just go to the farthest left there. Marin is the only county with vaccination rates above 80%. And also of note, the top 5 counties in the state are Bay Area counties, and are 5 of the 6 that came together on the initial shelter-in-place order. So we are relatively protected as a Bay Area region through having strong public health infrastructure and communities in Marin. We're fortunate to have a community that recognizes the benefit that vaccination offers, both for personal protection and for the community as a whole. And we're grateful that our community has stepped forward to get vaccinated when we were able to offer vaccines in mass vaccination sites. But the majority of these individuals have been vaccinated in our mass vaccination sites. As I mentioned last week, we are shifting our strategy now as we see more unfilled appointments in those sites to more mobile operations. And I'll share a little bit about Next slide, please. Importantly, we're not there yet, and this I think is one of the contributors to the case rates. The CDC guidance talks about dividing community into vaccinated versus unvaccinated people. It's really important for us to recognize that we have over 60,000 residents who are vaccinated but are not immune, and we have to behave as if we are not immune. And so, if you look on the right side there, what you see is only 44% of our population is fully immunized right now. So the minority of Marin County residents are fully immunized. That is 2 weeks after that second dose. 56% are not fully immunized. So a month from now, 6 weeks from now, we'll realize the full benefit of the vaccines that we've been offering over the past 6 weeks, but that has not yet occurred. And so we need to make sure that we're practicing physical distancing, covering our faces, doing all of the things that we were asked to do before we were vaccinated. Even though the vocabulary and the guidance uses that term vaccinated, we should really be thinking about this in terms of what people who are fully immune can engage in terms of our policies. Next slide, please. So one of the big steps for our vaccine distribution is going to be vaccinating our students. We've vaccinated our 16 to 18-year-olds, 77% of our 16 to 18-year-olds who came online on April 15th have been vaccinated with at least one dose. We had no serious adverse events in that age group. Our 12 to 15-year-olds are likely to come online as early as next week. And this is going to be an important drive for us. There are approximately 14,000 residents aged 12 to 15 in Marin County. We are awaiting the emergency use authorization. We're hearing that it could come as early as Friday. And we worked with the school community, with our pediatricians, and with parents to be teed up and really ready to hit the ground running when that authorization occurs. Our goal is to vaccinate at least 8,000 in the first week post-authorization and get through the remaining who are willing and eligible in the following week. And our parent schools and vaccine sites are standing by for that. Next slide, please. Briefly, these are the vaccine trial results for 12 to 15-year-olds. They enrolled over 2,000 adolescents. As we know, those studies basically very simple design. They organize it into two groups. Everyone gets shots. Some are getting the real vaccine, some are getting a placebo, and then they watch over time to see who gets infected. And in this study, all cases were in those people that were not actually receiving the real vaccine, were receiving the placebo. Among those aged 12 to 15 who were vaccinated, 0 cases among the over 1,000 individuals enrolled in that study. The antibody response and side effects was the same as for 16 to 25-year-olds, and now they're doing trials for 6 months to 11 years old, likely to come online in July or August. Next slide, please. So why is vaccinating 12 to 15-year-olds such a high priority for us? The vaccine, we've talked about this, protects yourself, but it also protects your family, your friends, and your classmates. We've been doing a lot of work with other required childhood vaccinations, measles, mumps, rubella, historically, over the past 5-6 years in Marin County. And that message that it is a matter of personal, but also community responsibility has been really important. We also see transmission that's happening in gatherings outside of school. We know that children are relatively well protected within the school setting with only 12 cases of transmission within schools. But what we're seeing is that, children, as you might imagine, as they gather outside of the school setting socially, physical distancing is less achievable. We're seeing more transmission in that setting. So vaccination would protect them against transmission there. It is critical to restoring normalcy in schools. If we don't vaccinate our children, we will continue to have to do the same things we've been doing all along to protect them, given that the virus is now part of our environment. Physical distancing in schools, facial covering, all the policies and procedures. They've done a really good job with them, but it's not something they're going to want to do forever. And being able to have vaccine will allow for more freedom in terms of curriculum. Entire middle schools and high schools can be protected with staff and students with high vaccination rates. And obviously it contributes to that community-wide immunity that I've mentioned. Next slide, please. So vaccine appointments are available. We want everyone in the county who wants to be vaccinated should have 0 barriers to vaccine. It's open to everyone age 16 and older. Same-day walk-in appointments are available at multiple locations throughout the county. Go to getvaccinatedmarin.org to find out where you can be vaccinated. Anyone who's had a first dose, didn't get a second dose appointment, or was confused about where they might be able to get their second dose, or received their first dose far away and they're not able to get back to that location for their second dose, can come into one of our sites and receive that second dose, but should check in advance to make sure they're offering the product, whether it's Pfizer or Moderna, that you need. Next slide, please. This is this week's mobile operations. As I mentioned, we are expanding our mobile operations as we start to scale down our mass vaccination sites, and we'll continue to publish on our website all the mobile sites where anyone in the community can walk up to be vaccinated without an appointment. Next slide, please. This is just to touch to where we are with the schools. We now have over 2 million student days accumulated in our schools across the county. 100% of schools are open to some form of classroom-based learning. Only 12 cases of transmission within the school setting, and 91% of Marin schools are open fully now to in-person learning 5 days per week, and an additional few are opening next week that have not yet opened full time. Next, please. So in summary, we're making strong progress in vaccinations. We have stalled at the margin between the orange and the yellow tier. We remain vulnerable to outbreaks because only 44% of our population is fully immune through vaccination. Vaccination remains our highest priority, same-day availability across the county for vaccines, and we are prepared to vaccinate our 12 to 15-year-olds. Next slide, please. Thank you. That concludes my presentation.
Thank you, Dr. Willis. Quick question for you. Are we 2 weeks now out before the possibility of going to yellow tier?
That's right. It resets again.
Thank you.